Hi there, how are you doing today?
Good, how are you?
I'm good. So let me set the context. My name's Scott Johnson. I am the state organizer for what's called 5051 for the state of Indiana, which means I'm the person in charge of wrangling this amazing herd of cats that we have. Now, behind the privacy screen, because we are protecting our sources' privacy, I have a person named M. M is someone who works for the federal government and has been impacted by the layoffs. And M is someone that I've known in a previous life, popped up in my text messages recently, I think when she realized that I was involved with the current resistance movement. And we got to talking, and I thought, in Indiana, it often feels like the federal government's 1,000 miles away, because geographically they are. But I thought it would be interesting just to know that this stuff is happening right here in our state. So, M, it's been unclear to me if you've been laid off yet or you're still working and you're just on a list. So tell us what your status is.
So my current status is on administrative leave, which means that I don't show up for work, but I'm able to draw a paycheck and utilize my benefits as a federal employee until they figure out whether or not I'm going to come back or I'm going to be eliminated from the workforce.
So they're paying you not to work.
Correct.
Wow, that feels like DOJ is not actually eliminating waste and fraud. It feels like they're causing waste. Huh. Okay. Now, as I understand it, from what you told me previously, you fall into that category of probationary.
That's correct.
Okay. Now, the Trump administration has portrayed a probationary employee as, oh, that's somebody who was just hired and they're in their workout period. Mm-hmm. But that's actually not true. Isn't that correct?
That's correct.
So talk to me about that.
So the way that the federal government works is that once you're hired, you either have a 1 or 2 and sometimes 3-year probationary period. Right. And
wow.
It took me over a year to get hired into the position that I'm in, even despite the fact that I was in that position as a contractor for over 2 years.
Wow.
Right. And it still took us a year to get hired. And so I was offered the position in August of 2024, but I started in December.
Oh, wow.
Right. It's a very long and arduous process.
Okay.
And so under the Trump administration, probationary employees were eliminated on February 14th, 2025. However, the courts came in and said, hey, this is illegal to fire people without cause.
Good.
And they brought me back.
Good.
Yes, and so I'm just sort of waiting to see what happens. Every day I check my email multiple times to see whether or not the final letter will come in.
Oh, man. So tell us what did you do for the federal government?
So I was a program director / social behavioral health scientist administrator.
Okay.
So basically I worked for the federal government to support the biomedical research workforce.
Got it. So you worked in public health.
Correct.
Okay. Now, public health is one of those areas where, unless you're involved in it, I suspect most Americans don't really have any understanding of what public health actually means.
Right.
Can you talk to us about what public health means?
Well, we have a very hard time articulating exactly what it means. However, we are those folks who are in the background, either conducting research, collecting data, doing analysis of the data to determine whether or not there's a threat to the public's health in some way or another, whether it be through food or water or the environment, sometimes microbes, things of that nature.
Okay.
In addition to chronic diseases such as cancers and arthritis, cardiovascular disease. So we take that data and then we develop programs or interventions, if you will, or treatments depending on what type of condition it is or the situation. Sometimes we modify policies or systems to maximize the opportunity for Americans to live a healthier, longer life.
Okay. So in other words, you're the people in the background that are keeping us safe all the time, even though we never actually see you.
Exactly.
Okay. So your specific work, what impact did it have on the public?
A significant impact.
Okay.
Our programs, our center actually, really supported cancer research and cancer clinical research in a way that no other program within the National Cancer Institute was able to do. Our programs started at middle school all the way through to research independence, which is the gold standard when you attain an R01, or that's sort of the gold standard. But the programs that we offered provided biomedical research exposure to kids who never would have received that type of exposure before, as well as their teachers. So we provided resources to enable them to see a life in cancer research for themselves, and to see sort of a pathway toward biomedical research. So our programs were in Appalachia and some of the hardest hit places in the country, rural America, tribal nations, as well as urban areas in Chicago and New York or Boston. But our programs really supported cancer people who were interested in developing a career in cancer research, and that's what we did.
So how do you feel about that Musk statement about he didn't do anything to affect people studying cancer?
I don't have a response for that. Because the people that I worked for, meaning the citizens of the United States who depended on the resources that we provided them to support them through their academic journey and then into their career to support cancer research, are some of the brightest, the most incredible scientists in the country who are working on treatments for brain cancer that you have a life expectancy of 5 years after diagnosis, if that. As well as other types of cancer, like triple negative breast cancer, which is the most aggressive form of cancer, which shortens the life expectancy of women by half. And so we were really, we were supporting the best and brightest scientists in the country.
So you were supporting truly public servants, in other words?
Absolutely. They're working on new medications or new treatments or new surgical techniques that might, get more of that cancer out of the body, or new chemotherapies or alternate therapies, or sometimes even prevention work in terms of helping people understand their cancer risk and ways in which they can reduce their risk through lifestyle interventions and environmental factors that they can change themselves.
Okay. Now, one of the things I've heard you mention when you and I were talking was health disparities. Now, why should people care about reducing health disparities?
We know that there's plenty of evidence to show that when people don't have access to an education or health resources or healthy foods or a healthy environment, then that shortens their life expectancy. And so if you are impoverished, if you are a woman, if you have ever received a Pell Grant or free or reduced lunch, if you're a person of color, if English is not your first language, these are all factors that play into whether or not you're going to have an equitable opportunity to raise yourself with your own bootstraps, if you will. And so that means that the wider the gap becomes over the years, there's a larger pool of people who suffer from those disparities. And disparities actually ends up costing us more. It's not just a matter of living a healthy lifestyle, it's also a matter of having a healthy, robust workforce and economic engine for America to thrive.
I believe that. Every time someone gets sick, it impacts the business.
Absolutely.
So doing some research here, we found one affected worker was quoted as saying, "The work that public health researchers, clinicians, scientists, and administrators do doesn't easily translate to the private sector." So I mean, America has tons of medical companies, but why is it important that work be done at the government as opposed to simply giving all of this to private industry?
Right. Well, there's a lot of reasons for that. I mean, and the first one that comes to mind is that if it's a company who's providing that, who's invested all of their funding into a new medication or things of that nature, that's not going to come back to the public at a reasonable rate, right? And we don't even know whether or not that medication will actually be covered. And a really great example is, the new weight loss medications. They're about $1,000 a month.
Yep.
And most people cannot afford it, and their insurance company won't cover it.
Yep.
So if you have cancer,
Go from there. So keep going.
okay.
Keep going.
So if you have cancer and your medication costs $10,000 because the company that produced this new medication wants to profit from it, which they should, and that's their that's what they do, right? But the federal government does things differently. We do things for the people.
Yep.
So part of that discovery is to make sure that we had a great example for this is the COVID-19 vaccinations.
Sure.
Had it not been for the COVID-19 vaccinations, we would have seen even greater disparities in terms of death and disability as a result of COVID-19. But because the federal government was able to fund that, we were able to immediately get something out to the American people.
Absolutely. Now, looking at you, it's pretty clear to me that you could have gone to work you made a choice to work in the public sector when you probably could have gone to work, particularly in Indiana. We've got a lot of medical companies here. You could have gone to work in the private sector and made more money. Why did you choose to go to work for the public sector?
I love public health, and I love serving the people. I had come from a long line of folks who served in the military, and it's a huge honor. I grew up in the military, so I just sort of grew up with this mindset of serving the people. And so public health really feels like the right place for me to be, because it's not money that I'm motivated by, but helping the world.
Yeah. And I have heard that type of response from, I can't tell you how many public servants, and it's one of those things that the people in our administration in Washington seemingly do not understand, that there is a higher calling in the world than making a ton of money.
Exactly.
And
that's, I think, partly why there are so many people in the workforce right now trying to figure out, okay, how do I translate what I did for the federal government to the private sector so that the private sector will want to hire me. And it is a challenge. Our skills are very similar, but the approaches might be different.
The approaches can be very different, and not every public service skill actually works in a private context.
Exactly, yeah.
Okay. So let's talk a little bit about your personal experience. So how long, so you got into your role in December, and then you got notice in February that you were...
That's correct. February 14th at 7:30 p.m. when I checked my email that night.
and
Valentine's Day.
And from what I know about you, you had always wanted to get to public health.
Always.
Right, like that this had been a pinnacle that you had moved up towards.
Yes.
And you finally got there, and then 2 months later, I'm so sorry.
Absolutely. Yeah.
So,
I've worked my entire career the aim has been to work at the federal level.
Okay. So tell me a little bit about how it took you to get that role and what qualifications brought you to this.
Well, I took a pivot early when in my late 20s, and I went back to school. I earned a Bachelor of Science in Education, secondary education. Quickly learned that education was not going to save the world. It helps, but it's not going to reduce the impact of HIV and things of that nature. So I was fortunate enough to be able to go back to school and work on a master's in public health.
Good.
And I worked at the state, local level, and federal level for many, many years in different capacities, both in the private sector as well as the public sector. And was fortunate enough to have a friend who knew someone who connected me with a contracting agency that had a contract with the federal government at the National Cancer Institute.
Good.
And I began my work a journey as a contractor with the agency several years ago.
Wow.
Oh, and in addition to that, a requirement for someone at the National Cancer Institute to be in a program director role or social behavioral health science role, you have to have a doctorate. So in the meantime, while I'm working full-time these last few years, I'm also working full-time on a doctorate, and will defend my dissertation in June. But that is a prerequisite for getting into that role. And I was just fortunate enough to have the support of my supervisor to hire me before completing my doctorate.
So that really speaks volumes to your credentials and ability to do the work if they took you despite that.
Absolutely. And
Okay.
we also, our team won a Director's Award, a National Cancer Institute Director's Award for our strong work in health equity.
Fantastic. That's awesome. So how did you find, so I think you mentioned that you found out you were being fired just through an email?
Yes.
Oh. Now,
My personal email as well.
did you get that? Did you get the infamous fork in the road email, or was it a different
did.
one? Oh,
Well, pardon me. I received the fork in the road prior to that.
okay.
Yeah. So everyone received the fork in the road multiple times via
Yep.
email. And then the letter that I received was actually, a separation letter.
Okay. And I think you said you got that in December, and you got it in
February 14th.
February 14th. Okay. Now, were you able to wrap up and shut down your projects, or was all that work just?
Unfortunately, no. And I had a lot of projects. And because the federal government works on a shoestring, our center really operates across branches.
Yep.
So I was working on multiple projects outside the scope of the work that I was hired for, but related, but
Yep.
in various branches and across the center. So that meant that everyone else had to kind of pick up. Whoever was
Yep.
left had to pick up the pieces.
Oh.
Yeah.
Now, did you get? Now, it seems like the focus was just getting people out of the government. Mm-hmm. Okay.
Yeah, it seems that way.
Now, did they give you any kind of severance package at least, or was it just your?
Just the 4 weeks.
Just the 4 weeks.
So I was fortunate enough to be offered pay from February 14th to March 14th.
Okay. So now I'm going to ask you about some government statements that we've seen come out from these. I will skip the adjectives. I won't be inflammatory. So Andrew Nixon, who's the communications director for U.S. Department of Health and Human Services, said recently, the COVID-19 pandemic is over and HHS will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago. HHS is prioritizing funding projects that will deliver on President Trump's mandate to address our chronic disease epidemic and make America healthy again. Now, from a scientific perspective, how valid is that statement, or is that just propagandist bullshit?
It is propaganda.
Okay.
Because we know that if it's not going to be COVID-19, we will have another pandemic.
Absolutely.
Or we will have another outbreak of some type or another. And we see one happening right now with measles,
Yep.
right? And fortunately, it seems to be relatively under control, but it's now affected multiple states. And with regard to COVID-19 itself, we still don't know the origin necessarily of
Yep.
COVID-19. We don't know how to treat long COVID, which many people suffer from.
Yep.
And the focus on chronic disease is wonderful. I spent many years in chronic disease prevention and control, so I'm happy to see that. However, it's not just, the government doesn't operate in one particular area. We need to have, it needs to be multifaceted so that we're doing research and development in lots of different conditions so that we can keep everybody healthy. And when we need it, we can deploy the next therapeutic treatment as it's appropriate, or the next vaccination like we were able to do for COVID-19. And why did the rest of the world come to us? Because we are the top of
Yep.
the biomedical research arena in the world. People come to America for the latest and greatest treatments and prevention and therapies. And so
I hear you. I fundamentally agree. Like, public health in America is one of those things that the people don't understand, but it is an absolute gem as to what America does best.
Well, and COVID-19, we realized at that point, I was fortunate enough to serve on the President's COVID-19 Health Equity Task Force.
Okay.
And so we pulled apart all the different problems that occurred,
Yep.
that bubbled up through the COVID-19, and we put forth recommendations for the President at the time
Yep.
to consider. And fortunately, I know for sure 30 to 40% of those recommendations had been implemented by the time that administration had ended. But what's so important is learning from those examples. And the big takeaway from COVID-19 is that our public health system, because we've underfunded
Yep.
year after year,
Yep.
it operates on a shoestring,
Yep.
as it is. And so when you have a fragile system and you have an epidemic of some type,
Yep.
whether it's the opioid addiction epidemic or COVID-19 or the measles, you have to have a robust public health workforce and system to be able to respond appropriately, so that there's fewer people dying and fewer people suffering as a result of whatever that condition might be.
Absolutely. I completely agree. So there's a lot of talk about government spending. There's even more talk about government waste. But it seems like one of the functions the government fulfills in modern society is to seed research that broadly benefits the country and the world.
Yes.
Now, those benefits often return more in investment, and as far as I can tell, a heck of a lot more than what the government spends on the work. Like, how did your role return an investment to the American people?
Right, that's a really great question. And because we do so much work and it varies across the board, the return on investment can vary as well, from $1 to every dollar that's invested to up to $80 or more in return, depending on the condition and things of that nature. My work specifically, and how I was able to bring a return on investment, was that I also brought with me public health. Part of my public health training is quality improvement. And one of the benefits that I was able to bring was opportunity to streamline things, make them a little bit leaner, work with the fewer resources that we have to maximize that opportunity for the public. And so when you're a federal employee, that's something that's at top of mind. Is this going to benefit the most people for the amount of money that we're investing?
Got it. Awesome. So you've done it, been very gracious with your time. You've gotten some great answers. So I guess just one question on a human level. Like, I mean, you've had multiple jobs in your career. Do you feel the government has treated you fairly, has treated your colleagues fairly, or does this feel like you guys have been kind of scapegoated for what's going on?
Well, let me preface this with, I believe that there's always opportunity for improvement. So, and we all embrace that, right?
Yep.
There's always an opportunity to re-examine, okay, if we've been doing the same thing for 20 years, does it still work? Do we still need it? Does the public need it?
Yep.
Right? So we're very much open to examining what it is that we do and how we can realign or make that, do things in a different way that would benefit the most people. So we were open to change, and we expected change with the new administration. My concern has been how it's been done, because it hasn't been done methodically, and there isn't an oversight.
Yep.
We don't understand the methodology that's being used to identify
I
whether or
don't
not
think there is one.
And fraud, waste, and abuse, let me just put this out there. Fraud, waste, and abuse is something that the government takes very seriously. And we have internal audits and systems for auditing, as well as external audits, so that it's third party is auditing the records to make sure that we are not wasting the taxpayers' dollars. So for someone to identify that much fraud, waste, and abuse seems interesting to me.
Oh, I'd go with insane, but you have a more measured approach.
So I would imagine that it's based on terms that people don't really like, and there's a reason for it. There's plenty of evidence. We have to show evidence for every single thing that we do. When we put forth a budget to Congress, we have to show evidence for why we're asking for those dollars. And so that's what's so critical, is that everything that we've asked for is on a shoestring budget to begin with. And so we haven't expanded the workforce in the last 20 or 30 years. The federal workforce has pretty much stayed the same, but the work has increased. Right?
Yep.
So it's very concerning that we're taking, a slash and burn approach rather than a scientific, evidence-based approach, and it's not transparent either.
Yep. Okay. I mean, now being an outsider, it kind of feels to me like the approach that they're using is like their idea of how government works. Like, because if you look at it from the outside, it's awfully opaque, right? So you don't see the internal safeguards, you don't see the checks and balances, you don't see the internal audits. So you just say, oh, well, they're spending that much money, there must be waste. And I think as Americans have seen, there isn't the waste. And when you start and when you have an official function, what's called the inspectors general, which guard over, their job is to look for waste.
Yes.
When you start your term by firing the inspectors general, you aren't really looking for waste.
Yeah. No.
Right? Because you would have worked within the system that has been there and has been functioning for a very long time. Right? You're just looking to make basically headlines.
And they saved American tax dollars, billions of dollars
Absolutely.
annually.
I know at least one of the inspectors general had fraud investigations to the tune of over $100 billion that they were looking at. And yet they fired that person and that work never got finished.
Absolutely.
So, well, Em, this has been fantastic. Thank you so much.
Thank you.
All right.